Well, you'll have to forgive the hat. I am out preaching the gospel of Medicare right now, so this is what it is. But I thought I would give another little Medicare minute on some topic that most people I think are interested in, and it's the misunderstanding of what Medicare covers with long-term care. A lot of people assume that if they ever need to live in a nursing home, that Medicare will or at least can cover that cost indefinitely. And that assumption makes sense, right? Especially if you're an agent who's new to Medicare. Medicare is the primary health insurance program for anyone 65 or older. So it's just common sense that it's going to cover most of your healthcare needs, at least in retirement. However, Medicare was never intended or created to design or function as long-term care insurance. To understand why, we need to go back to Medicare's inception in 1965 to see what it was originally built for. Because Medicare's original purpose was to address very specific issues. At that time, most older Americans had difficulty attaining or at least affording health insurance because private insurers didn't cover seniors like they're required to today, or at least didn't have to like they're required to today. So Medicare then was structured primarily as medical insurance for acute care. So that includes things like doctor's visits, outpatient surgeries, hospital stays, physician services, medical treatment, short-term rehab. You guys get the idea. In other words, Medicare then was built to help people recover from illnesses, injuries, or medical procedures, right? But long-term care is a different category of care. Long-term care usually involves custodial assistance, so help with your daily living, things like eating or feeding yourself, bathing yourself, dressing yourself, mobility if you could get around, maybe supervision due to cognitive decline or something like that. So those types of services are incredibly important for many families, but they're not always considered skilled medical treatment, right? Because of that distinction, Medicare generally doesn't pay for any kind of long-term custodial care. Now, that doesn't mean Medicare never pays for nursing facility care. It absolutely does, but only on a short-term basis, right? So there's only special circumstances where Medicare is paying for skilled nursing care. So if someone has a qualifying hospital stay of at least 3 midnights or 3 nights, and then requires skilled rehabilitation, Medicare can cover care in a skilled nursing care, but it's only for a limited period of time. And that's typically going to include services like physical therapy, speech therapy, occupational